like and subscribe. Now. Doctors of Reddit, what is your most surprising I can't believe I need to have this conversation with an adult story? Paramedic here. Was driving with my partner and patient in the back. Patient was fine. Patient's skeezy boyfriend was riding in the front with me and apparently saw a golden opportunity to ask a question that had obviously been on his mind for some time. So when cats and dogs eat grass, that means they have cancer, right? Me, no it does not. Made for an awkwardly silent ride the rest of the way. Well, it looks like she is about 30 days pregnant. Congrats. How can she be pregnant? She is only around her brother. Well, actually they don't follow the same moral code as you or I. Veterinarian. My fragile sanity wishes you had started with veterinarian lol. That the 30 plus cups of coffee he was drinking every day could possibly be the cause of his chief complaints of anxiety and insomnia. He said he was not willing to give this up or try decaf. 30 plus. Man, I'm such an amateur. Your heart thanks you for your amateur ways. As a veterinarian, I had a 10-minute conversation with an owner explaining which side was the dog's left side. I worked at a vet clinic when I was in high school. One day a vet came out of an exam room and asked me how to tell whether a puppy was a girl or a boy, thinking it was a joke or a trick question. I said, you flip them over and look. Right. The vet sighed and walked away. Apparently this client, who fancied herself a breeder, multiple litters at this point, expensive breed, had asked dead seriously how you tell if a puppy is a boy or a girl. Got placed doing a rotation in the orthopedic floor of a big hospital in a rural area of Southern California. I was doing my rounds and saw a patient out of bed and walking around the floor following a knee replacement. She had a cane in her hand that she was carrying, like as a soldier would carry a rifle. I asked what she was doing and what she thought the cane was for. She replied she thought the cane was for pushing people out of her way since she's now handicapped, and it wasn't to help her walk on her post-op knee. This is the first response that genuinely made me laugh out loud. I can just imagine some cranky old woman swatting people out of her way. I have a cranky old woman story for you. My mom worked at a nursing home as a cook. They ended up having to take away the electric wheelchair of a resident that was 107 because she kept running people over when they made her mad. She was my mom's favorite resident. My friend is a student doctor and is on placement at a small town doctor's office. She had a 70-ish-year-old woman come in with complaints of a small but painless growth that was visible at the back of her throat. Turns out it took her 70 years to notice a uvula. That must be the uvula. So it's a girl house, monster house, 012, full scene, 116. Was so not a film for kids. When you look at the whole movie and its contents, there were sexual and drug references. It was pretty scary for a kids movie, and I just felt a more teenage vibe watching it. Not a doctor, but I regularly have people come in for eye examinations because when I take my glasses off things are blurry. Often these aren't passing comments during the exam, but the main reason for their visit to the clinic. My mom tells it so much better, but here's a try. My mom was the head nurse at a clinic here in Houston in the 80s. She worked for an old WWII doctor that had gone into private practice, old school GP, when he returned back to the States. Well, one afternoon she told me that they had a patient come in that was running a high fever and was complaining of pain in her pelvic area. Mom also tells me that there was a stench coming from the woman's lap that could only be described as enough to gag a maggot off a meat wagon. She begins to interview the patient, who told her that her and her boyfriend had been sexually active and that she has been in pain since. She thought that the woman may have contracted an STD and asked her to undress and wait for the doctor to examine her. The doctor arrives and closes the door, only to reopen it a few seconds later, mentioning about the need for fresh air. The doctor noticed that there was a vaginal discharge, began to question the patient about her sex life. Was it protected, non-protected, etc. According to mom, the patient told her, no doc, we always use a rubber. The doctor looked down, then noticed that there was a small rubber band extending from the woman's vagina. The doctor reached in with his gloved hand and pulled it out. What came next can only be described as a magician pulling the magic cloth out of someone's mouth. One rubber band after another came out over the course of the next 10 minutes. Finally, once they were all removed, The doctor had the talk with a woman about sex education and that rubber bands were not a successful contraceptive and not what they meant by wearing a rubber, and then wrote her a prescription for ABX. TLDR, mom was a nurse who had a patient use rubber bands as a contraceptive device who ended up with a severe infection and required medical attention to get them removed. To be 100% serious, this is why proper sex education is so critically important. A 32-year-old grown man asked me if the hot spells he was experiencing at night meant he was going through menopause. I had to explain to a grown man I still work with that tampons don't break down in a woman's urine after they were finished using them. He's been married 12 years. It was not his best day. My mother helps the Amish get dental care. One Amish woman complained that she needed new dentures. When asked why she thought so, she replied, "Well, I've lost weight, and you know that when you lose weight, you lose it in your gums first." Doctors and dentists, if you're looking for a community to serve, the Amish can truly use your help. I could write a book about the things I've seen. While on dermatological rotation, a Middle Eastern patient saw me with what she described as some funny, itching growth in her butt crack. Some quick investigation revealed it to be a severe case of genital warts. I explained the diagnosis and that it was an STD until she shockingly assured that she was still a virgin. Now virginity is a big issue for young Muslim women, or perhaps their families even more, but apparently that doesn't cover anal sex, and therefore no birth control in the form of, say, condoms was needed. EMT here. I had a grown adult try to explain to me that someone else his pants got toned out for finger pain at a homeless shelter at 0200. We get there, and the guy jumps in the truck with very mild swelling to the tip of his right index finger. Here's how the conversation went. Me: "So what happened?" Patient: "I smoked some meth, and then I fell asleep in my bunk, and I woke up next to my bunk and my finger hurt and there was poop." Me: "There was poop? Did you fall in poop?" Patient: "No, like in my pants." Me: "So, you pooped your pants?" Patient: "No, it wasn't me." Me: "So let me get this straight. You smoked meth, took a nap, rolled out of bed in your sleep, hurt your finger, and someone else came along and shin your pants before you woke up." Patient: "Yeah, it wasn't me. My brother is a general practitioner in rural Tennessee." Enough said. Right. He says most of his patient visits go about like this. ND: "Well, person, you're pre-diabetic, have high blood pressure, and are complaining about joint pain. Have you been exercising and cutting out sugar and carbs?" Person: "Yeah, I have. Doc, but it doesn't seem to help. Do you have any better meds you could prescribe?" ND: "Well, let's talk about your diet. How much water do you drink a day?" Person: "I don't like water, so I get extra rice in my sweet tea every day to make sure I get enough water." ND explains how that's not enough water by a long shot. "How much sweet tea are you drinking every day? Those can have a lot of sugar in them." Person: "Well, I get a large one from a D/McDonald's/wherever on my way to work with my breakfast, and another one on my way home for dinner. Then I have a glass or two when I get home." ND: "Well, that's a lot of sugar and a lot of fast food. If you are eating it twice a day, what do you eat at home?" Person: "I don't like to cook, so I usually don't eat anything but Little Debbie snack cakes at home." ND: "Those have a lot of sugar too." Person: "I thought that all I had to do was cut out Mountain Dew. Now you're saying I can't eat my food or my snacks. What are you suggesting I do? Eat salads for every meal? Why can't you just up my meds?" I'm not a doctor, but my mom doesn't have a good grasp on the reproductive system, so I had to be the one to explain that getting my tubes removed did not remove my ability to get a period, that we women have a urethra, a vagina, and an anus. Babies do not come from the urethra. This one was strange, because she had me and my sister, so that when you neuter a dog, you just remove the balls, not the red rocket too. China/Taiwan sex ed was severely lacking, so my mom, until she was in her 20s, believed that if you sat on a seat still warm on the bus that a guy sat in before you, you can get pregnant. If you kissed the guy, you could get pregnant. I'm still finding out years later misconceptions that my poor mother has about reproduction, and explaining things to her. Had to explain to an adult you have to brush all the sides of a teeth. Like, no, just the side that shows when you smile. is not enough. And yes, flossing is not just a thing for rich people. Had a patient in a high priority area for DKA. Sugar was in the 800s. Stomach pain, nausea, vomiting and the such. Pulled Burger King and gummy worms out of his backpack and proceeded to eat them. Like, bro, do you even know what diabetes is? Non-compliance and lack of medical knowledge is a big thing in Detroit. CNA here. I did a patient's glucose the other day and it came back in the 500s. They were complaining of stomach pain and nausea. Just really miserable. I reported the number to the nurse and, while we waited for insulin, the patient asked me to bring them ice cream. Why? Their reaction was very clear once I told them what their blood sugar was that they knew it was bad. Heck, they started crying, but then immediately asked for ice cream. Because that'll totally solve the problem. I mean, I'm a British girl, and I'm no stranger to emotional eating. But when your blood sugar comes back so high that the nurse has to drop everything to come treat you, it's probably no bueno to reach for the sugar. The nurse and I were able to convince them to throw away the pile of crap they had on their table. Soda, candy, piece of pie, etc. And that sugar-free apple sauce was an improvement over eating ice cream. But man, the next day, they were right back to ordering pizza delivered to the facility and not checking a single fruit or vegetable on their menu. My job is to support the patient, but damn is it hard sometimes. I can only positively encourage them to select healthy options. So many times, if they don't want to eat their vegetables, I can't force them to. Patient comes in at 2 AM for insomnia, clearly tweaking her brains out. Heart rate 200, can't sit still, bouncing off the walls. I suggest maybe easing up on the coke. But doctor, I love coke. I imagine her pulling out a shitload of coke at the spot and just ramming it to her nose. My dad told me about an extremely religious male patient who was concerned about his nocturnal emissions. He saw it as a offense to God and wanted to know what he could do to stop it. My dad's response, well, it's gotta go somewhere, guy. Nurse here, retired after 27 years on the job. The number of American 20-somethings that don't know if they are circumcised or not is surprisingly high. When one with urinary tract infection symptoms needs to give a specimen for testing, I ask, are you circumcised? If not, I have to tell them to pull back the foreskin before peeing in the cup. The number of guys who have asked, what's that, is way too many. For the record, I can count the number who were uncircumcised on 2 hands. I knew a guy who I'm 99% sure was circumcised who thought that he was not. Because circumcision is when you cut off the head of the penis. Yeah. No. I asked one patient who argued with me, what do you think that brown ring around your dick is? A beauty mark? No, it's a scar. I don't know how much of this is true. It was my cousin, who is a doctor, who told me he was in his first year in a clinic and people went there to have an appointment because he was good looking. Elder ladies loved him particularly, but this is totally unrelated. And the worst case was when this elder lady goes in with her granddaughter, around 8 years. She had a severely infected wound in her head. Upon close inspection, he saw the wound crawling with small maggots and the smell was terrible. He was pissed, of course, and asked why didn't she wash the wound and brought her earlier. She said she thought it would heal with time and was afraid to wash it lest water enters her brain and kills her. There was also this woman that took her 6-year-old daughter there to check why she still didn't have pubes. I'm not a doctor, but I suppose this is related. My mother, before she had kids, grew up not even knowing that you could breastfeed a baby. She was never told anything about what breasts were for, sex, and even about homosexuality. Her parents never talked about any topic that was considered taboo. My mother learned about that once she had her first baby, subsequently at 16. That is so sad. I grew up in the 90s, and every sitcom during that time taught me that I'd one day have a sex talk with my dad. I'd dreaded it for years, and it never happened. My parents didn't tell me jack sh about sex. Thankfully it was the 90s, so I learned enough from television. Lady had a broken jaw. She comes in after 2 weeks with an open mandible fracture. Referred her to the hospital for immediate surgery. She never went BC, it doesn't bother her, and she'll see if it gets better. So, not a doctor, but I work at a hospital. We had someone come into R&D because they needed their nails redoing. They genuinely thought it was a good idea to go to accident and emergency, to have their fake nails taken off and redone because they had gotten too long and become uncomfortable. Talk about being high maintenance. Not a doctor, but when I was in Afghanistan, a local man came up to us on patrol with his hand wrapped in a sheet. He was in visible pain and was asking for a doctor, so we got the medic to go see him, and I helped unwrap his hand, and it was just effing huge. He'd cut his hand very badly and, for whatever reason, kept it submerged in diesel for 3 days before seeking help. His hand appeared to have soaked up a shitload of diesel, or it was just infected to F, but it resembled a water balloon and lightly touching it caused it to piss liquid. It was nasty. Not sure if people know this, but diesel fuel will start growing shaft after a while. God only knows what itched to ride into that cut. Yup, that's basically what happened with my dad. The lube oil that got into a puncture wound on his hand had some passengers along for the ride and a couple of them were effing wicked nasty. He was legitimately concerned that they were going to float the option of just amputating to save him, because the infection he developed was insane and nothing they had could do more than slow it down. They had to create a custom antibiotics cocktail for him. Holy sh! I know the chances had to have been minuscule, but did he keep the hand? I honestly don't know. There wasn't much we could do on the ground, so we called in a helicopter and sent him back to Bastion, to the Roll 3 hospital. I can't imagine he managed to keep it. What the F? That was pretty much my reaction. There was a nursing student I had once who laughed loudly and exclaimed, "How can you possibly get an STD in your mouth? AHH, the innocence of youth. Wait till she has a patient who has an STD in their stoma." I saw a patient for a follow-up after 3-year visits in as many days for asthma. He was from another country, so this was the first time I ever met him. His lungs sound absolutely terrible, but he swears he is taking the inhaler every 2 to 4 hours with no relief. This raises suspicion to me, as the same meds are working in the air. I ask him to show me how he is using it. He holds it about a foot away from his mouth and does 2 puffs like Binnaker and swallows. I felt really bad. He had never received any education about his illness or medications. My great-grandmother used to do this. She was stubborn and wouldn't take any advice. So instead my family asked me to use mine when I was with her, so she could see the proper way. I don't remember if she ever caught on that coming to the earth for a pregnancy test is a very expensive way to do it. Apparently she didn't know you could buy one at the Rite Aid down the block. Seriously, don't come to the earth for a pregnancy test, cause the test results won't be the only surprise you'll be getting. Also, if you have diabetes, that you need to take your medication. No, getting fatter isn't the worst that can happen. The worst that can happen is that you'll die. That's why you're in the air with diabetic ketoacidosis and suffering organ damage. It's why you're gonna lose your toes. Take your goddamn meds. This hits hard for me. I had an uncle who I was very close to who was very sick the entire time I knew him. I know he had very severe diabetes, but I don't remember what else he suffered from. I have these distinct memories of him taking me to McDonald's so we could throw the fries to the seagulls that hung out in the parking lot, and he'd always have the heat on full blast because the circulation to his extremities was so poor. By the time he died, he lost both of his legs and 4 of his fingers. Irony was he loved basketball so much, he used to chase me around with his leg nubs and race me down the street in his electric wheelchair. He was really amazing. He never let me be afraid of his amputations or his condition. I even used to give him insulin shots, even though needles scare the shit out of me as an adult. He was a remarkable human being. I miss him, and I wish he could have known me as a real developed person. Unfortunately I was 6 when he died. I hope he'd be proud. Lol. I used to work with a girl who had a faint positive on a home pregnancy test. She came into work very excited about it one day. She's in her early 20s, known her boyfriend for less than 6 months, and they are trying to get pregnant. Needless to say, my other co-workers and I were a little perplexed. She was so excited that if she couldn't get an appointment with her gyno the next day, she said she was just going to go to the ER. What a waste of her money, and more importantly, the ER doctor's time and resources. That taking that weird plant they bought from a pharmacy online isn't 14.324 times better than chemo, and doesn't only attack cancer cells because it likes the acid environment in it. I was living in China and taught English on the side to a student whose mother was a physician. This was in 2012, just prior to the London Olympics. The mother wanted to send her daughter to London with a school group to watch the Olympics, but has reservations about it. I asked why. She said she was worried that her daughter would catch AIDS from using the public toilets. Yes, a doctor. My sister, who is a new Redditor and hope sees this, is a doctor, and 25 years ago, when she had her very first patient out of residency, and this patient refused to allow her to see her breasts, which were sore, and needed a mammogram to check out a lump. So sister asks why, and this girl, who is about 30 and single, said matter of factly, "Oh, that's lesbian. We can't do that. It's against the Lord's wishes." She loves telling this story at the dinner table on family gatherings, especially to our religious side. I'm a paramedic and recently transported an idiot who self-presented to the local hospital, who found he was having a heart attack, STEMI, and needed him sent to a bigger hospital for treatment. During my assessment, I asked him how long he'd been having chest pain. On and off for 12 months, he tells me. Any family history? One of the biggest indicators. Oh, yes. Dad died of a heart attack. Brother died of a heart attack. Both of them first presentation. Stone dead on the spot. No effing about. So, you have a 12-month history of intermittent chest pain, and a family history of your closest male relative spontaneously chucking hearties and dying, and you've never got it investigated. Furthermore, the only reason you came to the hospital tonight is because your family badgered you into it. I told him he needed a solid kick in the ass. To his credit, he agreed. Chucking hearties, using that on my next STEMI trip sheet. D. My dad's answer: I'm not a doctor. My dad had to tell a patient that they were not pregnant. The patient was male. I filled out 17 pages of symptom questions on WebMD once, trying to diagnose this odd pain I had. The results came back ectopic pregnancy, which I hear is especially dangerous for men. Thank God for WebMD. Not a doctor, but I agreed to pick up my good friend's wife from her pregnancy sonogram. Driving home, the wife tells me she's surprised it's a girl, because the last kid was a girl and it's supposed to go boy girl boy girl. Right. Statistically, that is more likely than many other patterns, such as, say, boy girl squid rock.